Hello, my name is Dharmik and I am a student of physiotherapy. So today I will discuss about Vojta Therapy. Vojta Therapy is a dynamic neuromuscular treatment method based on the developmental kinesiology and principle of reflex locomotion. This method is supposed to treat patients with disorder of central nervous system and musculoskeletal system. It was developed by child neurologist Professor Valsal Vojta in the 20th century and now used to predominantly in the old countries. So now we will discuss about main features of the Vojta therapy. So first one is the reflex locomotion. The reflex locomotion is the fundamental process of the Vojta therapy. The term reflex locomotion implies that the complete motor pattern does not appear spontaneously but only under peripheral stimulation applied on the different parts of the body. Provoke pattern concerning the whole body including the four limbs. The reflex locomotion mainly divided into two techniques, reflex creeping and the reflex rolling. So, reflex creeping, the creeping patterns involving head, neck, trunk and the limbs are facilitated at various triggering points or reflex zones. The reflex creeping, the various body trigger points are as known as reflex zones. There are 9 zones for the triggering of reflex locomotion. Second one is the reflex rolling. They are also used with the specific and special method of the triggering of particular zones of the body. Reflex locomotion is activated from the three main positions. First one is prone, second one is supine and third one is the sideline position. Now we will discuss about second main features of the Vojta therapy. That is sensory stimulation. In that sensory stimulation, touch, pressure, stretch and muscle action against the resistance are used in many of the triggering mechanism of in the facilitation of the creeping technique. Now third main features of Vojta therapy, that is resistance. It is recommended for the action of muscle and its various specific techniques are used to apply the resistance. So now we will discuss about some major indications of Vojta therapy that can be useful for the particular conditions like cerebral palsy, torticollis, spina bifida, congenital myopathy, hip dysplasia and the adult hemiplegia. In that we can use the Vojta therapy for the betterment of the patient. Some objectives. So now we will discuss about the objectives of the Vojta therapy. Modify the reflex activity of the young child and to orient it to the neuromuscular development in a more physiological direction. Second one is to modify the spinal reflexes in the lesion of the spinal cord. Control the breathing in order to increase the vital capacity of the patient, prevent the orthopedic degeneration in severe pathological condition, and it promotes Vojta therapy promotes an harmonious growth of the initiate the locomotor system. So this is all about the Vojta therapy. Thank you.